The province of Ontario spends more than $50 billion on healthcare annually, and as the Minister of Health recently made a point of explaining, about 1 in 5 of those dollars goes to doctor compensation. It's just the latest contentious moment between the minister and his physician colleagues. Here to elaborate on the province's point of view, Dr. Eric Hoskins. He's the Minister of Health and Long-Term Care for Ontario and the Liberal MPP for St. Paul's. And welcome back to our studio.
Thank you for having me.
Nice to have you here. I'm going to share some information with our viewers that you shared with the people of Ontario about a week ago, actually. Sheldon, if you would, let's bring these numbers up. Ontarians spend more than $11 billion annually for doctor compensation. Compensation has gone $750 million over budget over the past 4 years. There are 34,000 doctors in Ontario. Average annual compensation, about $368,000. 500 doctors, you told us, mostly radiologists and ophthalmologists, billed more than $1 million apiece last year. And you told us one doctor billed $6.6 million last year. First question is, why did you feel it important to share that information with Ontarians last week?
Well, Steve, first of all, I've been trying to get the OMA to come back to formal negotiations for more than a year now. The information that I shared last Friday really isn't of surprise to them. For a number of years, we've been trying to work with them on an issue that's called relativity, which is looking at those highest billers and trying to understand exactly what's behind that level of billing. And we've learned that often it's because of technological advances where a procedure like cataract surgery that used to take more than an hour now can be done in under 20 minutes. We need to make sure that we're adjusting our fee codes, what we pay physicians, so that we're paying them fairly, but based on technological advances. So I felt that after an unsuccessful year of me wanting to return to negotiations and asking the OMA to do that, I felt that it was important to share that information and that perspective with the public as well as with the membership of the OMA.
I don't have to tell you that a lot of doctors felt humiliated and shamed by that presentation, and I wonder why you thought it was a useful tactic to get them back to the bargaining table by humiliating and shaming them.
Well, again, this is information that has been widely held by the OMA for a number of years. They've identified it themselves as a problem and a challenge. We haven't been able to make headway on it. But what I was trying to do is speak in part to the 98% of physicians that weren't referenced in that press conference, those that are as hardworking and deserve to be fairly compensated. They're the best compensated on average in Canada. I make no apologies for that. They are the best in Canada. But what I was trying to do is demonstrate also opportunity, where I believe it's not just how much we pay our physicians overall, it's not just the budget, it's how those funds are distributed in a fair way as well.
I get that. Why don't you, I mean, you had unilaterally imposed a settlement in the past. Why not just do that again?
Well, we need the OMA at the table. Like, the best way to do this is to collaborate in partnership with the OMA to go through the fee codes, to make those changes. We could and have, unfortunately, over the past year, needed to make some changes unilaterally to be able to stay within budget. However, I mean, it's important to say that over the course of the negotiations the last 2 years, we presented to the OMA more than 80 different proposals, separate proposals, looking at finding savings. They didn't respond to a single one of those. We needed their advice. We needed their guidance on which ones were most appropriate and fair.
You're a doctor. You're a doctor. You know how there's, what, 7,000 different fee codes upon which doctors can charge? If it's a fee for service, you know how the system goes. Why not just implement it?
Well, again, the best way to implement it is in partnership with the OMA, and so that's why we want them back at the table. We have made some modest changes over the course of the past year, but it's unfortunate that out of the more than 7,300 fee codes that physicians can charge under, or bill under rather, the OMA has not been able to present to us a single fee code that they believe needs to be lowered because of fairness.
At the end of the day, I presume what you want is greater certainty for the amount of money you're going to need to budget for doctor compensation. And because doctors are paid so many different ways, fee for service, salary, capitation, I guess, family health teams, FITs and FINs and family health networks and all these other things, it's difficult to do that. Why not just come to the conclusion that the best way to get cost certainty on doctor compensation is to put every doctor on a salary?
Well, we also need to look at how we compensate physicians. And so this is precisely what you're speaking to. And it's interesting that when we had the year of negotiations in 2014, where we brought in a facilitator, David Naylor, to try to bring the two sides closer together. Then we brought in a conciliator, retired Judge Warren Winkler. And Warren Winkler, one of the recommendations that he made to both the OMA and the government is that we create a panel, or a table rather, that look at precisely this. We look at where we look at the requirements for physician reserve resources going into the future, and we look at how we compensate them so that it's done in a way which is accountable but also fair and respectful to physicians themselves. So, of course, when Winkler issued his decision, his recommendation, when he recommended to the OMA that they accept the government's offer in the negotiations, the OMA decided not to accept his recommendations. And what the government has been forced to do, which is quite frankly what we agreed in writing, the OMA and the government, to do, we followed the process which allows us to effectively implement Winkler's recommendations, which is what we've been doing over the past year.
No, I get it, but what about putting every doctor on salary?
Well, we do have a variety of models. The majority of physicians still come under the fee-for-service model as well, but I think that it's not one size fits all. There are unique, our physicians and how they practice are often unique, and circumstances change around the province. There are some models that work better for physicians and for communities than others. So I think we do require that mix, but that was what that table recommended by Judge Winkler was intended to do. And of course, we invited the OMA to participate in that table, but they have, although initially expressing some interest, they haven't joined the table.
Dr. Hoskins, are you a baseball fan? You a Blue Jay fan?
Sure.
At all?
Not
Okay.
as much of a fan as my 10-year-old son.
I get it. Because here's a bit of this is a bit of a question out of left field here. Remember David Price?
Yeah.
David Price was the pitcher who left Toronto after having had a great season. He went and took a $200 million offer from the Red Sox. A lot of Jays fans were unhappy about the fact he took so much money from the Red Sox, but the reality is the Red Sox were going to give him that money and the Jays weren't. So here's the analogy. These highly paid doctors that you were kind of decrying in your press conference a week ago, you know, they didn't decide to pay themselves that money. You give them that money. You are the payor. And I wonder if it's fair to sort of blame the people who are receiving the money for the fact that you think they're overpaid when you're the guy paying them. You agreed to these conditions. Is it fair to blame them?
So I wasn't blaming them, and I made it very clear, in fact, in the press conference and subsequently, that nobody's suggesting that they've done anything wrong. What I did point out, however, is that they are, in a sense, seeing an advantage because the fee code, the amount that they're being paid, hasn't kept up with technological change. Another example are doctors that prescribe methadone to Ontarians that have addictions to opiates. So there are, I think, 24 methadone prescribing doctors who are billing the province more than $1 million. Many of those are actually generating as much or even more than half of their billings from a single procedure, a urine dipstick test, which generally, almost always, is not even performed by a physician. It's performed by a nurse or another person in the clinic. And so we looked at that and realized that that was not an appropriate use of resources. It was often being performed more frequently than it needed to be as well. And we were compensating more than we should given the hard costs of the tests. Well, so we made that adjustment and we've found that we need to continue to do that. Or with radiologists, for example, because of changing technology and computer software, the fact that that X-rays, for example, and procedures are now all digitized, they have the ability to be much more efficient and effective in reading and reporting on those. That's a good thing and a good thing for patients, but our payments need to reflect that.
I hear you, but I spoke to an ophthalmologist this morning to prep for this, and here's what he told me. He said, every 5 years I have to buy all new equipment because the state of play in this industry is changing all the time. He says he just spent $1.4 million on equipping his office with the newest and latest equipment. And it may well be that he bills 7 figures, but after you take away, office, staff, equipment renewals and all that, he's not taking $1 million home. He says there's no appreciation or understanding of that in your department.
Well, there certainly is, but there are also many, many doctors that have no overhead. So radiologists that practice in a hospital, for example, or emergency room physicians as well. So the overhead varies according to specialty, but even so, and there are many ophthalmologists that are billing nowhere close to $1 million. But what I wanted to point out is that there are 2% of physicians that are billing 10% of the physician services
So
budget.
go after them.
Well, it's not about going after them. It's about actually reviewing how they're billing and what they're billing for, and then going through those 7,300 fee codes, but going through the ones which are most predominant, and saying, given technological advances, this is what we did several years ago with cataract surgery, where we made some modest deductions because it's a more efficient process now. We need to do that with our cardiologists, for example, because there were 57 that had billed more than $1 million. We need to see what's behind that, and it may be wholly appropriate, given the technology that exists, that they should be compensated at that level. But it's an issue that's been identified by both the government and the OMA a number of years ago. It's been well known within the membership of the OMA for many, many years.
Okay, well,
that
here's
these
what I don't
disparities
get.
exist.
Here's what I don't get. You saw there was first time in 30 years I can recall doctors going to Queen's Park to protest. I think it was about 500 of them out last weekend. Got some pictures of it here we can roll in. To complain about what the Ontario government was doing. As I understand it, your problem is with a couple of the most specialized doctors in the province. And it seems to many observers that you have alienated the other 90% of doctors in order to get at this 10%. I mean, as a tactic to get to the finish line, how is that smart?
Well, I think that I was actually attempting to be fair to the 98% and speaking to the 98%. Who are just as hardworking, who are working those same long hours, who spent the same amount of time in university and, to get the specialty degree, or are family doctors, or are pediatricians and psychiatrists that are at the lower end of the scale. The average doctor in Ontario bills the government before overhead $368,000, but it points to the necessity for us to get back to formal negotiations. And so what I wanted to do a week ago is speak to where I saw some opportunity that had already been identified by the OMA, but they hadn't been able to provide any solutions. And so what's important, and I've been asking the OMA for more than a year now to get back to negotiations. I've been prepared literally the next day to resume talks. And that's been consistent over the last year.
But they wanted binding arbitration as an option to be part of the discussions.
Well,
is that now the case?
Well, I've been very clear for a long time, and the OMA knows this, that I've been willing, and the government has been willing to discuss and consider mediation arbitration as part of formal negotiations. But we have to get back to the table to have those discussions. And I've also been clear that it can't simply be about one thing. It can't simply be about arbitration. And by the way, 80% of the doctors in Canada have no arbitration at all. And in fact, a number of provinces are moving away from arbitration with their doctors. British Columbia and Nova Scotia just passed legislation recently. So notwithstanding, I know this is important to the OMA, so we're willing to discuss it at formal negotiations. But it's equally important, and I think it's important for Ontarians as well, that we also discuss access to primary care. We also discussed a predictable and sustainable physicians budget going forward. We've overspent the physicians budget by $750 million over the last 4 years.
Cap it. Cap the budget.
Well, again, we our preference, so we have no intention of capping it. We've increased it by about $140 million this year. It has consistently gone up year after year after year, the amount of money, that overall envelope that we pay our physicians. But we want to be at the table so we can work with the OMA to be fair and respectful to our physicians, to reach an agreement. We're prepared to discuss mediation, arbitration as part of that. But in the absence of their willingness to come back to the table, but I have to say, though, I'm hopeful, and I know that there'll be a new set of leadership coming forward after the AGM that the OMA are having this weekend. They have a strong negotiations team, so I'm hopeful that now that they've indicated that they are prepared to come back, that we'll have an opportunity to do that.
I have a bit of an odd last question.
Sure.
You're a doc. Are you concerned that your former fellow colleagues in the profession somehow see you as a traitor to the cause because of the position you're taking on this?
Well, you know, I've worked extremely hard to get my message across formally through the media, but also informally when I engage with physicians and other healthcare providers, quite frankly. I think on the one side, there's a certain amount of confidence because I am a healthcare practitioner, that I have an understanding of how the system works because I've practiced as a physician in this province as well. I'm a family doctor and a public health specialist. But for me, it's much more important than that. My job is to represent all Ontarians. My job is to make sure that patients and their caregivers, their loved ones, their households, their communities, that when they need health care, that health care is there and it's of the highest quality that we can provide as a government. So, and physicians, particularly our primary care physicians, but all physicians are the backbone of that system. We can't provide the level of service without them. And in fact, they've been responsible for many, many of the gains that we've seen over the past decade.
So aren't you concerned you're alienating them?
Well, I have a dual responsibility. I have a responsibility to all Ontarians. I also have a responsibility to reach an agreement with the OMA on behalf of their more than 30,000 members, an agreement that I believe we can attain, which is fair and respectful to the profession.
Understood. Dr. Eric Hoskins, Minister of Health for the Province of Ontario, we thank you for coming into TVO tonight and answering our questions.
Thank you.
Help TVO create a better world through the power of learning. Visit supporttvo.org and make a tax-deductible donation today.